So I'd be happy to take everyone on a day in the life of a neurosurgery PA, but I needed to pick up my juice first. So I'm gonna start off in the OR today. It's gonna be a spine case. I don't know exactly what case it's gonna be, but I will revisit that after I actually scrub in for it. Now that I'm in my office, I'm going to change into surgical scrubs and then go on down to the OR. All right, now we're going to put the lime in the coconut and then drink it all up. We got done with surgery about 2 hours ago. I just got kind of sidetracked and forgot to make the rest of this video, but typical day in my life. So I'm either in the OR, I'm on the floor on the hospital side, rounding on patients, or I'm in the clinic. I did my clinic last week, so I now have the floor this week, as well as if I need to go in the operating room. When I'm on the floor, I am usually with one other PA, and we are seeing post-op patients as well as new consults. We also have a resident, and then we just got a new resident, so the list is split up pretty nicely at this moment. It could be as little as 6 we had last week, or at most 2 months ago, I think we had around 38. So that was super chaotic, but we get contacted by the ED or internal medicine or any other type of specialty already on the floor if there's any type of brain or spinal concern. So I get to the hospital around 7:30, and then we immediately go into sign-outs with the rest of our team. We go over any consults overnight, any post-op day ones, or just continuity of care from patients that we've already seen throughout the week. Rounds can end anywhere between like 9 o'clock all the way up to 12 o'clock, depending on the patient load. Then I go speak with my attending, whoever is the surgeon for that patient. I give them updates and then give them my plans. And if they have different plans or agree with it, then I'm just on my merry way to do whatever work I need to do. This is different than on OR days. So today I had 1 surgery, and other days I can have 2 to maybe 3 surgeries. A lot of the times the fellows are covering those surgeries. So unless there is just a need for an extra hand, then the PAs usually step in and scrub into those procedures. Either way, I usually get done around 4 o'clock, and then we do sign-offs again at 4:30 just for closing remarks going into the next day. And then I usually leave around 4:45. And then when I'm in clinic for a week, I will see my clinic patients. It could be at most 14, but I would say the average is probably like 7 or 8. So that's pretty much a typical day. I'm rotating between those 3 areas. Now I just need to finish a few notes and then do sign-outs at around like 4 o'clock, 4:30, and then call it quits, head home for the weekend, and then that's it. If you enjoyed this video and want to see more, feel free to hit that follow button. And if you have any other questions, feel free to leave a comment down below or send me a DM.